I am Dr. Majid Iqbal, physiotherapist. In previous video, I have talked about the case of this patient named Karim Bhai. In this video, I will show you the exercises after the operation of upper end of humerus. He got fractured earlier. Now he operated by the orthopedic surgeon. You can see the exercise of the patient. Yes, I am giving the elbow exercises, elbow movement. You can see. You can see the X-ray film. Here is the fracture, and the plating is done here in the upper end of humerus. The fracture is not completely healed. That's why the exercises should be in gentle way. So I am giving the gliding just slightly and gently, gliding the shoulder joint. Very gently giving the rotational movement of the shoulder joint. You can see here. Okay. Okay, this is abduction of shoulder. A slight and gentle movement. Slowly you have to give the movement and increase the range of motion. Okay. Not to give forcefully movement because fracture is not completely healed. Okay, this is horizontal flexion of the shoulder joint. Okay, you can see the movement of the shoulder joint. Okay, he is cooperating very well. I am doing the flexion of shoulder joint where rhythmically and slowly gentle movement should be given. Okay. Okay. Okay, very carefully, very careful. Okay. Okay, patient is cooperating the movement. Okay, it is not so painful. You can see the movement. Okay, now I am giving the internal rotation of the shoulder joint. Slowly. Okay, movement should not be very forcefully. Okay, he's waving the hand. Okay, now external rotation is left. I am doing external rotation of shoulder joint. Shoulder joint is restricted more rather than the other movement. You can see this movement is restricted. A little bit he is feeling pain in this movement, that's why the force is applied is very less. Now he is shifting the position. He is in side lying. The affected side should be in the upper position. I am doing extension of the shoulder joint slowly. Okay. The range should be increased slightly. Now you can see the range of motion is increasing gradually. Extension of shoulder joint in side lying position. Okay. 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 Internal rotation in side lying position. Okay. Once again, this is flexion of the shoulder joint in side lying position. In this position, the patient feels very less pain in comparison to supine lying position. Okay. I am giving flexion of the shoulder joint. Okay. It is over. It is over.